Dr. Thomas Albrecht from Berlin, yes, who will show us the 2-year outcomes from 4 pooled multicentre RCTs, safety after treatment with the paclitaxel-coated devices.
Thank you. Good morning, ladies and gentlemen. I would like to present our results of a pooled analysis of 4 randomized controlled studies that we participated in. These are earlier DCB studies, and all those 4 studies were part of the original Katsanos paper. And we went back to the patient level. We had data, we had access to all the individual files, and we sought to look for if we could reproduce the results, and this was recently published in CVIR online. So the purpose was, what we did was to analyze mortality based on original data of 2-year follow-up of Thunder, FEMPAC, Pacifier, and Consequent. We performed a logistic regression model of predictors of 2-year mortality. We looked specifically at the causes of death and at paclitaxel dose. The key patient and lesion characteristics were well balanced between the control group and the DCB group in all these 4 studies. Now, this shows you the number of patients with 2-year follow-up available in the individual studies. And I think this is a very important slide because you have, if you want to look at mortality, you have to know how many, what your patient base is. And what was done in the meta-analysis was that basically the number of patients originally recruited were taken, then those reported as dead, and that was used to calculate mortality. However, this is not quite the truth. You can see here we had different dropouts in the different studies. Overall, a slightly higher number of dropouts in the control group compared to DCB, about 25% more dropouts. And we had a patient base of 185 altogether in the control group and 184 in the treatment group. So if we look at mortality, a couple of things to point out. First is that the mortality was actually quite variable between the studies, with the lowest mortality in both groups in the Consequent study and the highest mortality in the FEMPAC study. Overall, we had 13 of 185 deaths in the control group and 16 deaths of 184 in the DCB group, which translates to 7% and 8.7%, and this was statistically not significant. And these are the relevant Kaplan-Meier curve, which really show overlap, considerable overlap and no significant difference. We also looked specifically at the causes of death. We grouped them into cardiac, malignant, sepsis, and other. 2 and 3 cases were unknown. And again, you can see that the causes of death are quite well balanced. Cardiac, similar numbers, 6 and 4. Malignancy, 2 malignancies in the control group, 3 in the paclitaxel group. 2 cases of sepsis only in the control group. And then others. This is really where the drug-coated balloon group sort of stands out. And it's really very much a mixed bag of things like stroke, amputation, thrombosis, multiple organ failure, brain hemorrhage, and trauma. Now, even if one were to assume that the 3 excess deaths that we had in the paclitaxel group were caused by the paclitaxel, I think it would be extremely difficult to understand a mechanism which accounts for such different causes of death as we're seeing here in our results. The logistic regression model, very similar to what Dr. Schneider just showed, found no influence of paclitaxel on mortality. The only significant impact on mortality was age above 75 years. All other variables we tested did not have an effect on 2-year mortality. We also looked at paclitaxel dose, which we actually measured. We measured the residual dose on every single balloon that was used and calculated from that the amount of paclitaxel that was actually given to the patient. And you can see that those patients that didn't die actually had a slightly higher dose of paclitaxel than those that did die. So in summary, we found no significant difference in mortality between drug-coated balloon and controlled in our pooled analysis of 4 randomized controlled studies. There were no obvious patterns of causes of death. The only predictor of mortality in these studies was patient age, but not the use of paclitaxel. There was no dose relationship. Thank you very much.